Hello everybody, myself Dr. Archana, a consultant homeopath from Chennai, Tamil Nadu, India. I am practicing homeopathy since 2014. I have my clinics in Arumbakam and Amjikarai. I run my YouTube channel in Tamil in my clinic name Dynamic Homeocure to spread Dr. Hammer's discoveries to Tamil speaking people. I am associated with Global GHK since 2017. Global GHK is 9 years old now. Dr. CJ Varghese sir, the founder of Global GHK Foundation, has conceived this noble idea to celebrate Dr. Hammer's birthday as World GNM or GHK Day. All the supporters of GNM or GHK contribute video lectures and testimonials to mark this celebration on our Global GHK YouTube channel every year to pay tributes to Dr. Hammer. Ever since this celebration started in 2022, we are consistently uploading videos to educate simple yet powerful concepts of GHK. Likewise, every year, 26th of January, we celebrate as Global GHK Day, that is our foundation day. And for its 8th anniversary last year, 2025, I was talking on liver and its conflicts. In that video lecture, I mentioned that I will be speaking on gallbladder and bile duct conflicts in future. So today, I take the opportunity to speak about gallbladder conflicts and bile duct conflicts. I trust this will be a useful presentation for you all to dismantle many myths and to understand many facts. Once again, wish you all a very happy World GHK Day. Let me share my screen. So today's topic is gallbladder and bile duct, understanding the territorial conflict or identity conflict. As I already mentioned, myself Dr. Archana, a consultant homeopath from Chennai, Tamil Nadu, India. Disclaimer, the information given in this presentation is for educational purpose only. It is not intended to be a substitute for professional medical service. Participants shall consult their medical doctors for health reasons before using anything that is disclosed during the course of this presentation. Students shall not use any of the different information given in this presentation while writing their examinations. Tributes to Dr. Samuel Hahnemann, the founder of homeopathy, and tributes to Dr. Hammer, the founder of GNM or GHK. Tributes to my Guru Dr. Praful Vijaykar sir for enlightening the Indian homeopaths with GNM or GHK knowledge and taking homeopathy to the sky as expected and dreamt by its founder, Dr. Samuel Hahnemann. Gratitudes to my GHK mentor, Dr. CJ Varghese sir, and Global GHK Foundation for giving me this opportunity. So what is gallbladder? Gallbladder is a pear-shaped, small, hollow organ located beneath the liver. You could see here. So it is seen beneath the liver in the right hypochondriac region of the abdomen. We call this area of abdomen as right hypochondriac region. In that area only, our gallbladder is located beneath the liver. So whenever you have pain in the right hypochondriac area, we usually suspect problem with the liver and gallbladder. The gallbladder connects to the hepatic system with the cystic duct that leads directly into the common bile duct. So here you can see, so this is a common hepatic duct and this is the neck of the gallbladder, and these together connect to the common bile duct, and this common bile duct gets connected with the pancreatic duct. This area is called as ampulla of Vater, and after joining with the pancreatic duct, it enters the duodenum. So liver produces a digestive fluid called bile, This bile is stored and concentrated in the gallbladder. When food, especially fat, enters the intestine, the gallbladder contracts and releases the stored bile into the digestive tract through the common bile duct. So this is a biliary system and bile duct. I was telling with the previous slide, no? So this is a common hepatic bile duct and this is a cystic duct. Together they join and form the common bile duct. Common bile duct get connected with the pancreatic duct, and this conjunction or this connection area is called as hepatopancreatic ampulla of Vater, and this together enters the duodenum. So the bile ducts branch through the liver in a tree-like structure. The common hepatic duct joins the cystic duct. Common hepatic duct is in the green color. It joins the cystic duct, which is in the yellow color, and they both together form this orange color common bile duct. So common bile duct meets the pancreatic duct, which is in blue color, before it opens into the intestine. Okay, bile produced in the liver and stored in the gallbladder flows into the duodenum. That is the first part of the small intestine through the common bile duct. Okay, common bile duct, and it helps in digestion of food, especially the fat. Bile also helps the body to get rid of waste materials that is filtered out of the bloodstream by the liver. So first, before understanding anything about the disease pathology, we need to know the structure and function of the organ. So we are understanding the gallbladder as well as the bile duct in detail. So gallbladder and bile duct, the lining of the gallbladder consists of squamous epithelium and it is derived from the ectoderm and controlled from the right temporal lobe of the cerebral cortex. In the right temporal lobe, we have so many parts. So premotor sensory cortex, motor cortex, sensory cortex, post-sensory cortex, and visual cortex. So this lining of gallbladder is controlled from the post-sensory cortex of the temporal lobe of the cerebral cortex. So if you see the cross section, you will understand the relay center is placed here. The control center is positioned exactly across from the brain relay of the rectum lining. So exactly on the left side of the same layer of the brain, you have the rectal surface mucosa brain relay also. You will understand in the future slides why we are mentioning about all these things. So the gallbladder, bile duct, the small curvature of the stomach, pylorus of the stomach, duodenal bulb, and the pancreatic duct share the same brain relay and therefore the same biological conflict. So all these structures have the same brain relay, which means all these structures will be affected by the same conflict. So it could happen one at a time or all at a time. So which one of these organs will be affected by the DHS is random. That is what is mentioned in German New Medicine. But I will request all the fellow homeopaths to give a thought upon this because nothing is random in nature. A severe conflict can affect all organs at once. So when you have a severe conflict, that one single conflict which affects all these organs, if it is in the very intensified form or if it is in the severe form, means it will affect all the organs at once. So here I wanted to tell this thing. So this I have spoken in detail in many videos. So once again, I wanted to stress upon this because stress and conflict are not the same. So usually when you go to a doctor with some complaint and they are not able to find any findings in your blood parameters or in your scan report, they attribute the cause as stress. So stress is a very, very broad terminology, but that is not the case with conflict shock. So we address the reason for all the physical ailments as conflict shock from GNM understanding. So conflict shock and stress are not one and the same. So stress is a very broad terminology used for anything happening on the emotional or on the mental plane. But conflict shock is something very unique. So you need to know the difference between these two. So nature of conflict shock is sudden and unexpected. It could be figurative or imaginary. It is related to the function of the organ. It happens in split second, happens before the appearance of physical signs and symptoms, common to all human beings, not common to all living beings, not only human beings. So highly individualistic in nature, and it happens on the subconscious level. So it is not under your control, and it happens suddenly and unexpectedly also. So this is not the case with the stress. So what is that one potential conflict which can affect these organs, namely the gallbladder, bile duct, small curvature of stomach, pylorus, duodenal bulb, pancreatic duct means? Let's see. It's not the one conflict, but it is two in number. Those two are territorial anger conflict in males and identity conflict in females. So, territorial anger conflict and identity conflict are linked to gallbladder, bile duct, pancreatic duct, small curvature of stomach, pylorus, duodenal bulb. So all these structures are affected by male territorial anger and female identity conflict. So only if the conflict is sudden and unexpected and emotionally traumatizing, it will produce symptom on these organs. So day-to-day stress is not equal to conflict. And one more point you need to understand here is depending on a person's gender, laterality and hormone status. So why we will see now. So one more thing about the cerebral cortex is that in line with evolutionary reasoning, territorial conflicts, sexual conflicts and separation conflicts are the primary conflict themes associated with organs of ectodermal origin controlled from the sensory, premotor sensory and post-sensory cortex. So they will follow this pattern. So I told about this gender laterality and hormone status. So we will see that in detail. So the production of sexual hormones, including estrogen and testosterone, occurs primarily in the ovaries and testes. But the control is from the brain. So the hormone levels are controlled from brain. So the estrogen status is controlled from the left temporal lobe and the testosterone levels are controlled from the right temporal lobe. Okay. So the conflicts affecting the right lobe will have impact on the testosterone levels, and the conflicts affecting the left temporal lobe will be having impact on the estrogen levels. So in GNM, we speak therefore of a female conflict area. So this left side is called as a female conflict area and right side is called as the male conflict area. So with the impact of a DHS in the female conflict area, the estrogen level decreases proportionally. So when we have a conflict on the left side of the temporal lobe, it has an impact on the estrogen levels of the person. So conversely, with an impact in the male conflict area, the testosterone level goes down. So when you have a conflict on the right temporal lobe, this will have an effect on the testosterone levels, and the testosterone levels are expected to go down. So in GNM, we call this a conflict-related hormonal imbalance. So in GNM, we call this as a conflict-related hormonal imbalance. Only because of the conflict effect on the brain, and the brain is the only one thing which is controlling our hormonal levels. And this will cause a hormonal imbalance, and it is called as conflict-related hormonal imbalance in GNM. So any change in hormone status will have an impact and a reverse impact on the conflict perception also. So change of the hormone status alters a person's biological identity. So when a female is having low estrogen levels means her biological identity itself is changed. Similarly, when a male is having a low testosterone level, means his biological identity itself is changed. So in such situations, the way they perceive the conflict also changes. For example, when a woman is in postmenopausal stage, her testosterone levels are relatively higher than estrogen, and she therefore experiences conflicts just like a male. So, this explains why certain conflicts or certain disease conditions are so common in postmenopause. So, in females, the estrogen level decreases during pregnancy and nursing after menopause with an ovarian necrosis. So these are all physical conditions. So during pregnancy, during nursing, and after menopause also, her estrogen level goes down. So when the estrogen levels are going down, means uh, the lady's biological identity itself is changed, and she perceives the conflicts like a male. So this is the reason why during pregnancy and during nursing, certain conflicts are manifested very, very much, and which are those conflicts which are not seen otherwise. So we can explain from GNM perspective why certain conditions, disease conditions, and conflicts are only seen in pregnant ladies, or only during nursing, or only after menopause. So it is because of the low estrogen levels, the female's perception itself is changed like a male. So in males, similarly, the testosterone level decreases in elderly men with the testicular necrosis in both testicles when both testicles have been removed and due to testosterone lowering medications. In the same way, for females also, when both ovaries are removed, or when estrogen lowering medications are given, or contraceptive pills are used, birth control pills are used, her estrogen is suppressed. Okay. So these are all the small things we need to understand and remember while understanding the conflict the person has encountered. So after radiation or chemotherapy, the production of sex hormones drops altogether. So after a radiation or chemotherapy, if a person is coming to you, keep this uh, sex hormone getting reduced and the perception of the conflict itself changing in mind while inquiring about the conflict of the person. So in GNM practice, the knowledge about gender, laterality, and hormone status helps us to understand the conflict encountered by the person with 100% accuracy. So during pregnancy, why certain females are affected by territorial anger conflict means it is because of the low estrogen levels. So let's see the shades of this conflict in a person's life. Territorial anger in males. A territorial anger relates to anger in the environment and places which one considers as his or her domain, literally or figuratively. So it means there are two important things in this conflict. One is the territory, and second one is the anger. So anger is the emotion, and where is the anger? It is in the domain or the territory of a person. So where and all you can see this situation. So fights at home, heated arguments at workplace with one single person or with group or with the institution itself. So anger at school, in kindergarten, at the playground, in a seniors or nursing home, or in senior citizens home, or in the hospital. Extended territory such as village, town, country where one lives. Here and all, if you have anger issues and it is happening suddenly and unexpectedly, so it may affect your gallbladder, pancreatic duct, pylorus of the stomach, and bile duct. So disputes over a land or property, annoying noise in the house or neighborhood, a fight over a parking place, a fight over a toy or belonging can also provoke this conflict instantly. Okay. So remember these conflict scenarios. These are all male conflicts usually, but when a lady is in a post-menopausal stage, or when she is in her pregnancy, or when she is nursing, when her estrogen levels are low, these conflicts, these situations can provoke the territorial anger in her because her perception itself is changing. So this is one interesting fact we need to understand. So marking the place or territory with feces or urine is a typical behavior of mammals. So mammals mark their territory with their urine and feces. You would have seen in the dogs, stray dogs and all. So they mark the territory with the urine and feces. Hence, the rectum-related identity conflict is similar to a marking conflict involving the renal pelvis, uterus, bladder, and urethra. In the brain, the control centers of the rectum and the bladder are located right next to each other. You can see the conflict brain relay center here. So bladder, pelvis, renal pelvis, urethra, all the relay centers are located next to the rectum and rectal surface mucosa. Okay. So what is an identity conflict in females? An identity conflict refers to the inability to establish one's position or place. That is the territory, literally or figuratively. The conflict is to a certain extent a decision conflict. Not knowing what choice to make, not knowing where to go. So territory of females, it is a smaller territory, not like males. So males have a huge, bigger territory. Females have a small territory. So this one's position and place is the component, and with the confusion and decision as components in the identity conflict. So where and all or in what scenarios we can expect this identity conflict in females? An unwanted move, change of school or change of a workplace, feeling unsettled, not knowing where to belong, not finding one's place in a relationship within the family, the group at work, or in the culture and society at large. You can relate all these things with the day-to-day things we are seeing in our life. See, when in India, the girls are getting married means they are sent to the other house. Other house means that husband's house. So most of the time, we get a history that the lady says that she has uh, a rectal complaint or urinary complaint only after the marriage. Why means it is because they feel that where do I belong? Not finding one's place in a relationship. Most of the time, this is the identity issue we encounter. So this is a very important point to remember, or while understanding the conflict, you need to know these things which are coming under the shades of identity conflict. So discrimination against one's belief or sexual orientation. So this is also very common in India. So this sexual orientation discrimination is very common in India. So I have a few clients who have a girls who have a high testosterone levels, and on probing or understanding the history, they say that they are treated in a second hand position because the elders in the family say that if you would have born as a male, or if you were a son to me, we would be carefree and all. So this sexual orientation or this discrimination of sexual orientation can also instantly provoke the identity conflict in females. So according to the second biological law of German new medicine, so during the conflict active phase, if cell proliferation is happening, so after the conflictolysis, cell necrosis happens. So in certain tissues where cell necrosis happens in the conflict active phase, after the conflictolysis happens, cell proliferation takes place. So which organ will undergo cell proliferation and cell necrosis? We will understand from the germ layer as well as the brain center from where the germ layer is controlled from. So this is a tricolor of GNM or GHK. Yellow represents endoderm, orange represents mesoderm, red represents ectoderm. So endoderm is controlled from the brainstem. Old mesoderm is controlled from the cerebellum. New mesoderm is controlled from the cerebral medulla. Ectoderm is controlled from the cerebral cortex. So our bile duct and gallbladder are from the ectoderm, and they are controlled from the um, post-sensory cortex of the temporal lobe of cerebral cortex. So you might have watched my second biological law video. So in that I have given in detail about this hanging conflict and hanging healing. So if the conflict is not allowed to undergo a conflictolysis, and before the conflictolysis happens, only the tumor or cell proliferation or whatever it is addressed or disturbed means the person will live with the conflict activity forever, and this is called as hanging conflict. And the person is undergoing a conflictolysis and he is having healing symptoms on the physical plane, and the healing symptoms are not allowed to get completed, and the program is not allowed to run fully means, then the person will be in a hanging healing. So this is the difference between hanging conflict and hanging healing. So these are all the reasons for our chronic conditions and repeated complaints in our body. So Dr. Hammer says if the patient has been made aware of all the facts, he will no longer need to get frightened by his symptoms. He can now fully accept these as the healing symptoms they are, all of which had until now caused fear and panic. If the greatest number of cases In the greatest number of cases, the whole episode will pass without any serious consequences. So it is a duty of the German new medicine therapist or the uh, service to the mankind, as Dr. C.J. Varghese sir always says. So it is our duty or humanitarian responsibility to educate the people about the conflict and the conflict active phase and the healing phase, and how to resolve a conflict and what to do when you are already in a healing phase. So when the person is made aware of all these things, he will not be afraid of these things, and he will allow the healing to happen by the biological wisdom of the body, and he will wait for the healing to get completed without interrupting them through medications and any other external aids or surgery or whatever it is. So what are all the conflict active phase manifestations in a gallbladder? So ulceration happens. So we saw in the second biological law, no? So during conflict active phase, gallbladder undergoes cell necrosis, cell destruction. That is why ulceration happens in the lining of the gallbladder, and this ulceration is directly proportional to the conflict intensity. The ulceration could also involve the cystic duct. So what are all the symptoms you expect on the physical plane? So conflict active symptoms are mild to severe pain depending on the intensity of the territorial anger conflict. I told you, no, so it is in the right hypochondriac region. So the bladder is in the right hypochondriac region. So the person may experience mild or severe pain in the right hypochondriac region as per the intensity of the conflict. So when a person is coming to you with a pain in the right hypochondriac region, and you find that the gallbladder is only affected, you can very well understand that the person has not come out of the conflict, and he could be in the conflict active state, or he could be in the hanging conflict also. So what, as a GNM physician or GNM therapist, you need to do is you need to first resolve the conflict or downgrade the conflict so that healing happens automatically. So same is applicable for your bile duct also. Ulceration happens in the lining of the bile duct, and depending on the intensity of the territorial anger, the ulceration affects one or several ducts, and the symptoms will be mild to severe pain. When a person is coming to you with pain, the right hypochondriac region, you must know that he is in the conflict active state. He is yet to resolve the conflict, and or he is yet to undergo the healing process. So healing phase of gallbladder. So during the first part, I request all the viewers to watch my second biological law video, where I have given in detail about the conflict active symptoms, what is conflictolysis and how healing happens, and what are all the healing symptoms, and what is epileptic crisis. So healing happens in three phases: PCLA, epileptic crisis, and PCLB stages. So what are all these, you will understand if you watch my second biological law video. So now I will not go into the details. So that is not the topic of the day also. So I will tell you in brief. So the first part of the healing, during the first part of the healing phase, the tissue loss is replenished through cell proliferation because it is the ectoderm derived tissue. So conflict activity happens through cell destruction, and during healing, the cell reconstruction happens. So healing symptoms are swelling due to edema and abdomen pain in PCLA and PCLB. The pain is not of a sensory nature but pressure pain. So because of the fluid accumulation only, the pain happens. It is not the pressure. It is not the pain, real pain. So what are all the physical symptoms you will expect during healing phase of the gallbladder and bile duct program? Means you will have edema, abdominal pain, and inflammation. Okay, this pain is not equal to the pain which is happening in the conflict active phase. Conflict active phase pain is a real pain. This abdominal pain happening during healing phase is due to the pressure pain only. It is a pressure pain only. The nature of the pain itself will tell you the whether the person is in the conflict active phase or he is in the healing phase. So concurrent water retention due to syndrome. Syndrome is yet another topic which I have spoken in my second biological law video. So with the recurrent water retention due to syndrome, the swelling and the swelling increases in size, and it increases the pain also. With an inflammation, the condition is called as cholecystitis. So gallbladder inflammation is called as cholecystitis. So inflammation is a healing. Inflammation is a healing process, and you might have seen my video about the inflammation and understanding about inflammation from GHK perspective. If not, kindly watch the video. It's a very good video. Healing phase of bile duct. So what happens to the gallbladder? Same happens to the bile duct, but extra things we will learn how the bile duct healing manifests itself. So first part of the healing, cell replacement takes place and cell proliferation takes place in the cell necrosed area. In conventional medicine, this is usually diagnosed as liver cancer. The new cells cannot be regarded as cancer cells since the cell increase is in reality a replenishing process. So, in GNM, this benign and the concept of malignancy is totally invalid because the cell proliferation is directly proportional to the conflict activity and intensity of the conflict. So the demarcation between the benign and malignancy is totally invalid according to GNM. So healing symptoms are swelling, as we already saw. So recurrent water retention will increase the swelling and increase the pain also. So one more thing we need to understand when it comes to the healing of the bile duct is a large swelling in the common bile duct or in several ducts. We saw, no, so many ducts are there, ducts names and all we saw. So in several ducts block the bile flow resulting in jaundice. So what is jaundice? Jaundice is yellow discoloration of the skin, sclera, and urine becomes brown or deep yellow colored, and stool becomes light yellow colored due to the lack of bilirubin. A pancreas tumor can also lead to jaundice when the tumor obstructs the common bile duct that connects the pancreas to the liver. We saw, no? So pancreatic duct comes and the common bile ducts together, they connect and they enter the duodenum. So when a pancreas tumor is there also, It may also affect or obstruct the common bile duct, and it may also lead to jaundice. So nowadays we see jaundice commonly in newborns. It is called as neonatal jaundice, and many of you might have seen that phototherapy is given for the newborn kids. So let us try to understand this from GNM perspective. So conventional medicine presumes that the infant's developing liver is unable to remove bilirubin from the blood. Okay, so conventional medicine thinks that the liver is yet to develop fully, and that is why it is struggling to remove the bilirubin from the child's blood, and this is the reason for the jaundice they are saying. But if this is true, means it should happen to any and every child born on this earth, no? So it is not happening to every child. It is happening to certain children only, certain infants only. Why? From GHK perspective, jaundice in newborns is rather caused by a territorial anger that occurred already in the womb. If the mother has encountered a territorial anger conflict when she was pregnant, it could happen to the child. So this is all a very deep topic, intrauterine conflicts. So people who are interested to explore about this are requested to watch our video in our official website, uh, Global GHK website, where Dr. CJ Varghese sir has given in detail lecture about this intrauterine conflict. So fetus can also suffer a territorial anger conflict with or on behalf of the mother. So this is called as the suffering on behalf of somebody conflict. Okay, fetus can suffer the conflict of the mother. Certain children who are having the sensitivity or the nature of the mother will be affected by such conflicts. So, distress in the delivery room, a difficult delivery, or the way the newborn is handled at birth can evoke a territorial anger with jaundice in the healing phase when the baby feels safe. Okay, so distress in the delivery room, or the difficulty in the labor, or when the child is handled very roughly, can all provoke this territorial anger conflict instantly in the newborn. And once the child feels that he or she is in the safe hand only, they will be showing the healing phase symptoms, that is a jaundice. So on birth, or immediately 1 or 2 days after birth only, the child is showing this neonatal jaundice. This is because only after the resolution, or only after the conflict or lysis, the healing symptoms will be seen on the body. So I would say that this distress in the delivery room is a very, very huge conflict nowadays. So the way the mother is treated in the hospital, or the way they handle the hospital environment, which triggers the anger issues in the mother, is a major trigger in day-to-day situation, because I have encountered such conflicts during my both deliveries with the hospital people. So when we go against the protocols of the hospital, they get provoked, and this triggers lots of issues at hospital, and we instantly go into territorial anger conflict. And my both children had neonatal jaundice. So at the time I was not aware of this territorial conflict and all. After all, for my second pregnancy, I know that it was the territorial anger conflict which evoked the uh, jaundice in the second child, and I refuse strongly to give a phototherapy for my second daughter. For my first daughter, I was not aware of GNM, and I gave this phototherapy for her. So usually, out of curiosity, when I was searching for the solution or reason for the neonatal jaundice, I found that by giving lavish breastfeed, this jaundice can be cleared off. At some point of time, I was thinking, why is it so? What is the thing that is in the breastfeeding that is giving the this solution for this jaundice and all? So now I know that it is because the child feel safe and secured when they are fed or kept with the mother. So this is the reason why they can come out of the conflict easily. So healing phase of bile duct can also manifest as hepatitis. Hepatitis is nothing but the inflammation of the liver. So acute hepatitis indicates that the bile duct related conflict is reactivated through setting on tracks. Tracks is yet another topic, and in second biological law video you will know about it. So setting in a track can instantly reactivate the conflict, and this will be manifested as the acute hepatitis. So chronic hepatitis reveals hanging healing. I told you about hanging healing. When the healing is not allowed to happen and run its course, it will cause chronic hepatitis. So that is the reason why I showed the quote of Dr. Hammer, where he mentions what are all the healing symptoms we can expect during the healing phase must be told to the patient or to the person around us, so that they are well prepared for it and they are not afraid and in a panic state to rush to a hospital or get the thing to be removed through a surgery and all. This is the main purpose of GNM itself. So the understanding about conflict and about the whole SBS makes us empowered and in a better position to handle our healing symptoms. Icteric hepatitis, with the typical symptoms of jaundice, develops when a bile duct occlusion involves several ducts or the common hepatic duct. So hepatitis with icterus. Icterus means yellow discoloration. So when the bile duct is occluded means at that time you will have this icteric hepatitis. So fourth biological law of German new medicine says microbes do not cause diseases. Instead, they play a vital role during the healing phase. So diseases are not contagious. So with this understanding, even the same concept is told in homeopathy also, even before GHK brings this to our mind. Dr. Samuel Hahnemann 250 years back itself told that microorganisms are scavengers of our body, and they are coming into the body or in the organ only to remove the debris of the complete healing process. The same thing is told in German New Medicine also by Dr. Hammer. So fourth biological law says microorganisms are not the cause of disease, and diseases are not contagious. In fact, they are having a beneficiary role in the healing process and in completion of the healing. So which organism will come into play in healing phase of which germ layer organ is also given through German New Medicine. Them will have mycobacterium, that is TB bacteria and fungi during healing phase to complete the healing process. So mesoderm derivatives will have bacteria and TB bacteria during healing phase to complete the healing, and ectoderm derivatives have virus if they exist. So if they exist means, so virus, the existence of virus itself is a big controversial question. So it's a very big controversial topic also. I would strongly suggest everybody to read the book The Virus Mania, and also to watch videos by Dr. Stephen Lanka, and also Dr. Andrew Kaufman sir. So you yourself will understand whether virus is existing or not. So combined third and fourth biological law, I have prepared this tabular column. So brainstem, endoderm, cell proliferation, cell loss, mycobacterium. So our gallbladder and bile duct comes here, cerebral cortex from ectoderm. So cell loss during conflict active phase and healing phase, cell proliferation takes place and healing happens through virus if they exist. So healing phase of bile duct also shows inflammation we saw. So it is called as hepatitis. So conventional medicine claims that hepatitis is caused by hepatitis viruses. Hepatitis viruses A, B, C, D, E and all. However, as demonstrated in the publication Virus Mania, I told about this book, no? So Virus Mania book. So Virus Mania book says, certainly nobody has yet managed to detect a corresponding virus structure in the blood serum of so-called hepatitis C patients. As with HIV, the virus purification necessary for a clear identification has not taken place. It is given in page number 155. All are requested to read this so that you will understand the facts about viruses. So in short, none of the alleged hepatitis viruses or any virus has ever been scientifically verified. So whether virus is existing or not itself is a big topic and big question. So now comes the next question. If virus is not existing, what is the meaning of giving a vaccination? So this is what is mentioned. So this seriously questions the justification of vaccinating newborns and imposing vaccinations on travelers who naturally develop hepatitis after having resolved the territorial anger conflict away from the anger environment. So when already a person is traveling means he is expected to have some territorial anger, and once he is getting accustomed to that situation or used to that he comes to a conflict resolution means he will automatically go in for a healing symptom, usually a hepatitis. So what is the point in vaccinating them? So hepatitis with syndrome, I told you it's a big topic. So where water retention happens. So hepatitis with syndrome, that is the water retention. Water retention happens through active abandonment or existent conflict. So territory, travelers, you can relate all those things. So abandonment conflict, existent conflict, refugee conflict and all. So those things will instantly activate the kidney tubule programs and leads to enlargement of liver. Hepatomegaly with acute pain. So hepatomegaly happening because of the liver parenchyma program is entirely different, and this is totally different. I would request the viewers who are watching my video for the first time to watch my liver video which was posted last year for the World GHK program. Excessive water retention could create a critical situation since the additional water is also stored in the brain edema that develops parallel to the edema on the healing organ. So, psyche, brain, body are not three different entities. So conflict will have impact on all the three simultaneously. So when the body is undergoing healing process, there will be a simultaneous brain edema also. So when that is happening and the excessive water retention will lead to a critical condition called as coma, hepatic coma, and the patient may also even die. Because of the strong brain pressure, a person might fall into a coma, which is called as a hepatic coma by medical conventional medicine, and the person may even die. So liver cirrhosis. I have spoken in detail about liver cirrhosis in my liver presentation. So this is once again a repetition, or once again you will understand from the bile duct program and bile duct conflict. So liver cirrhosis is a conflict consequence of conflict relapses. So when the person is again and again put into the same territorial anger, the during the PCLB phase, the person will be undergoing repeated scarifications. That fibrosis happens again and again. As a result of the recurring repair processes in the bile duct, the squamous epithelium lining is gradually replaced by scar tissue in the PCLB phase. Over time, this severely compromises the function of the liver. So, repeated conflict active states or repeated conflict relapses will have effect on the function of the liver also. Hence, without addressing the underlying conflict, the condition might be fatal. So, underlying conflict without understanding GNM or without understanding the psyche of a person, we cannot clear the conflict and we cannot heal the body also. So this may lead to fatal situations like liver cirrhosis. So about 50% of patients with liver cirrhosis also develop ascites. So what is ascites means? It is the water belly. So this is not the fat belly. Fat belly is that fat accumulation in the abdomen. This is a water accumulation in the abdomen. So this will be very tense, and we have certain tests to find out that it is only ascites, not fat depositions. So, according to conventional medicine, the fluid in the abdomen is caused by high blood pressure in the portal vein of the liver. The same theory is applied to esophageal varices also. If this theory were valid, why does cirrhotic ascites then not occur in 100% of the cases? So if the fluid accumulation is taking place only because of the pressure, high blood pressure in the portal vein, it should happen in every person, no? Why it is not happening in every person? That is a question. So if every person is not having the same problem, and this reason given is cannot be accepted as 100% correct. So this fluid accumulation happens only in persons who have encountered abandonment conflict, existent conflict, or refugee conflict along with the territorial conflict. An existent conflict could also be caused by the diagnosis shock, since liver cirrhosis has generally a poor prognosis. So when a person's life itself is at stake means the existent conflict will be instantly evoked. So existent conflict can also come from a poor prognosis or from a diagnosis shock also. So this is the reason why a person has liver cirrhosis along with ascites. Not all the persons having liver cirrhosis have ascites. And one more thing. So, liver cirrhosis is usually attributed to alcohol consumption. Let us try to understand whether this is correct from GNM or logical from GNM understanding. So, liver cirrhosis has nothing to do with alcohol consumption. So, it is not the cause for the liver cirrhosis. That is what GNM is trying to make everybody understand. Just as there is no correlation between smoking and development of lung cancer. So lung cancer has nothing to do with the smoking. So we do not mean to say that you can take alcohol lavishly or you can smoke lavishly. So that is not the understanding. So this is not the cause for the disease. This can increase the symptoms, or this can worsen the condition, but this is not the cause for the disease. That is what we are trying to explain through GHK. There are people who have liver cirrhosis who do not drink. There are alcoholics who never develop liver cirrhosis. Then how can we say that liver cirrhosis is caused only by the alcohol intake? So even I have seen females who have liver cirrhosis. So who usually in India, drinking is not so common in females. Not so common. Only very meager number of female population only drink. Otherwise, it is not usually seen in females. So females also have liver cirrhosis. So they do not drink. So how can we explain this from the usual alcohol and liver cirrhosis concept of conventional medicine? But territorial anger conflict and drinking often goes together. So territorial anger, so to come out of the anger, person may go into addictive behaviors, addictive habits, and they may go in for alcohol addictions. And so this is what Dr. Hammer says. The majority of alcoholics belong to the lower classes of society. They are much more vulnerable to suffer conflicts than good citizens. So I have explained in detail in my liver video. Liver cancer does not come from alcohol, but alcohol and cancer come from sorrow and misery. I request all the fellow homeopaths to ponder upon this beautiful saying of Dr. Hammer. So epileptic crisis. So I told you, so healing happens in three phases: PCLA, epileptic crisis, and PCLB. So now let's understand the epileptoid crisis of gallbladder and bile duct. So epileptoid crisis manifests as acute pain because epileptoid crisis is nothing but the reactivation of the conflict active phase, and it is the height of healing. Only with the epileptoid crisis, the healing takes a U-turn and comes back to the normal state. So this minimum understanding you must know, then only you will understand it. Why pain is happening in conflict active phase, why it is happening in epileptoid crisis also. It is a brief reactivation of the conflict active phase. And it is a height of healing also. So during healing only it is happening. But what to say, the pain is very severe, acute, and cramps and bile, what to say, spasms happen during epileptoid crisis. It is like the epilepsy. That is why it is called as epileptic crisis also. So it is called as biliary colic by conventional medicine. The surrounding striated muscles of gallbladder undergo epileptic crisis at the same time. So epileptic crisis would last up to 30 hours. The spasms and pain can go for 1.5 days also. Okay. With the hanging healing, that is, when the healing phase is continually interrupted by conflict relapses, the buildup of bile eventually leads to the formation of gallstones. So, so repeatedly the healing is getting hindered uh, by any external means, or it could be wrong medications also. It could be any treatment or any modality which is not taking your psyche and mind and conflict understanding is not taken care of or not addressed, means there will be a repeated interruption of the healing phase. This repeated interruption of the healing phase will lead to buildup of bile and eventually leads to gallstone formation. So this is the thing we need to understand from the GNM. So repeated conflict healing getting hindered only will lead to gallstones. So gallstones is a major problem, no? So nowadays they remove the complete gallbladder only for managing this gallstones. So gallstones, why it is happening? It is because of the hanging healing. At one point during the epileptic crisis, they are pushed through the cystic duct and the common bile duct into the small intestine, which is very painful. These gallstones are pushed to the cystic duct and common bile duct and into the small intestine also during epileptic crisis, which is a very painful situation. So the PCLB, the gallbladder slowly returns to its normal function, because after if the person has survived this epileptic crisis and the epileptic crisis is not hindered, he will automatically, that is his own biological wisdom, will bring back the gallbladder to the normal functioning. So same is the thing with the bile duct also. So with hepatitis, the levels of gamma GT, a significant liver enzyme parameter, rises in PCLA with a sharp drop during the epileptoid crisis. The epileptoid crisis presents as acute sharp pain and cramps or spasms, which is called as liver colic, if the surrounding striated muscles of the bile duct undergo epileptoid crisis at the same time. In the PCLB, the bile ducts open and function of the organ returns to normal. I will request all the fellow homeopaths to relate the spasm, anger related remedies, everything, so that you will be in a better position to understand the conflict as well as the remedies which have the spasm and effect, anger effect, and holic covering medicines and all. You will be in a better position to apply that GHK knowledge in your day-to-day practice. So the fifth biological law says every so-called disease is a part of a significant biological special program of nature created to assist an organism, humans and animals alike, during unexpected distress. So this is the reason why the so-called diseases are called as significant biological special program in German New Medicine. So it is significant and it is biological and it has a special purpose. So let us try to understand the purpose behind gallbladder and bile duct program. So the biological purpose of the cell loss in the gallbladder during the conflict active phase is to increase the flow of bile to the intestine, which provides the individual with more energy to resolve the conflict. The biological purpose of the cell loss in the bile duct is to widen the duct to enhance the flow of bile to the intestine for better digestion. This in turn improves the metabolism, providing the individual with more energy to resolve the conflict. So the biological purpose is attained during the conflict active phase in case of ectoderm program. So this is a very important thing I wanted to tell you all before I end my presentation. So mind and body are not two different entities as we usually think. So when you have a problem in the mind, you have to go to a psychiatrist. When you have a problem in your body, go to that organ specialist. This is a concept prevailing nowadays. But mind and body are not two different entities. In fact, your psyche and body are in such a way connected that so your body is a mere reflection of the psyche only. So that is why I have given this image. So only if a person stands in front of a mirror, his or her image will be seen on the mirror. So when the person goes away, the image goes away. So when you have a conflict on the psyche level only, you will have a physical manifestation. Once the conflict is removed, the thing on the body also get cleared off automatically. So without understanding this, if you are correcting the body alone, what will happen? If you are constantly removing or erasing the symptoms on the mirror only, that is on the body only, what will happen? What major thing will happen? That is what we are doing for the past 5 to 6 decades, no? So what will happen? You have the answer for this question in my schizophrenic constellation video, which was posted during the 9th anniversary celebration of our global GHK. I request everybody to watch that video also for a better understanding. So we think that gallbladder removal is a solution for gallstones. We think that it is the end of the road. It is the solution for all the problems. But we do not know it is a mirage. It is a illusion only. So we think that it is over, but it is not so. So why it is not so? So instead of clearing the conflict, you are removing the organ only. But only by removing the organ, your conflict will not go off from your psyche. It is still active, means it will be shown in other organs where the shades of the conflict can be manifested, or it can also be shown in the person as constellations. So schizophrenic constellation video I have given in detail about conflict activity and why the treatments which are targeting only the body uh, are putting us in schizophrenic constellations, how schizophrenic constellations are increasing nowadays. Everything I have given in detail. So gallbladder removal will not remove your territorial conflict, will not remove your identity conflict. So identity conflict and territorial anger conflicts which are still active will be waiting like a bomb which is ready to burst, or like a volcano which is ready to blast. So this is the reason why gallbladder removal is not the solution. So instead of that, you can go for a holistic therapy like homeopathy, where we consider the conflict of the person, mind of the person, and we give medicines. So I'm not recommending homeopathy. Even GHK therapists who are not giving medicines are taking care of your conflict, and they are making you aware of your conflict so that you are in a better position not to put yourself again and again into the same conflict, or you are desensitized for that conflict, so that you are not affected so much by the territorial conflicts, and you are protecting yourself without any medications too. So which is a wise thing. So you have a pimple on the image on the mirror, and you are cleaning the mirror constantly. You are cleaning the mirror constantly. And this person is clearing the pimple on her face. So, which is a wise thing? Trying to remove the pimple on the mirror image, or it is the correction to be done on the person. So that is why I gave that example. So your body is only the mirror image of your psyche. So without removing the cause from the psyche level, if you are constantly cleaning the mirror, you will be endlessly doing the same. The clearing of conflicts while a person is already in healing, as it is practiced by certain alternative therapies, bears the risk of serious complications for a client. So, when the patient is already in a healing state, you should not provoke or bring back his conflict in the name of clearing the conflict. So, this is also one caution given by Dr. Hammer. I thought I should show this image once again as a tribute to Dr. Hammer on his birthday. The same holds true for psychological therapies. So, because we are also from alternative therapy, and we must know when to provoke or when to probe the conflict and when not to touch the conflict. So this is a very important thing we need to understand. Dr. Hammer says the physician has to understand the psyche, the psychologist need to understand medicine. So it is not two different things to be two different persons or two different specialists and doctors. These are all one and the same. So aggressive constellation, I told about the schizophrenic constellation. I will not go in detail about schizophrenic constellation, but briefly I will say, so combination of conflicts. So when two conflicts are in conflict active state and on the two brain hemispheres, the person will throw psychiatric manifestations or behavioral issues and mood disorders kind of manifestations you will see on a person. So when the gallbladder is removed means, and the conflict is still remaining in the person's psyche, he is expected to have a constellation immediately when the second conflict conflict hits the other side of the brain. So what will be the name of the constellation, or what will be the manifestation of the conflict, we will see briefly. In some other occasion, if time permits, I will explain in detail about aggressive constellation also. So mental diseases, mood disorders develop like physical diseases according to the 5 biological laws. So I told in detail about the 5 biological laws, no? So mental diseases and mood disorders also follow the 5 biological laws. The degree of mental state and constelled behavior is directly proportional to the intensity of the conflict. So aggressive constellation, this is from the website www.learninggnm.com website, which is a very authentic website by Caroline Marcolin Madam, who is a direct disciple of Dr. Hammer. So I must thank her also in this occasion, because whatever GHK knowledge I have is through through her website only. Whatever I have learned from her website only, I am trying to give to you all. So two conflicts, active, inactive phase, can instantly cause aggressive constellation. If you see this first and second conflict, you will understand it is nothing but the territorial anger and the identity conflict. So two conflict getting active will show in the person as aggressive constellation. So what is an aggressive constellation? The aggressive constellation manifests itself as compulsive aggressive behaviors. Dr. Hammer calls it as hero constellation. Why? Because the persons who are in aggressive constellation will show what to say, traits or behavior patterns or disease conditions also, as per the intensity of the conflict. So when the person is in a mild constellation, he will be having strong willpower, he will be very bold, he will excel through their resoluteness. So they make decisions, strong decisions and all. So in a little higher degree, if you see, means you see rebels, subversive, revolutionary, activist who fight for his ideas to the very end. So all these are from the aggressive constelled people only. So sudden aggressive outbursts. So that this is getting into disease state. So sudden aggressive outbursts, verbal eruptions, yelling, using an insulting language, fits of anger and rage are all aggressive constellation. So two conflicts active at the same time on both hemispheres of the brain. So what are all those two conflicts? It could be two territorial conflict, or it could be two identity conflict, or it could be one territorial and one identity conflict. So you all must know how important is it to maintain a very good interpersonal relationships in your territory, and to be clear about your identity also. So identity, self-worth, everything has a very major impact on your psyche as well as the body. So body piercing and tattoos. We usually do not see this body piercing and tattoos some 20 decades to 2 decades back and all. We don't see so much of body piercing and tattoos. Nowadays, we see so commonly. Any and every person is having one tattoo or body piercing in their body. So this is also a manifestation of aggressive constellation. So irresistible urge to argue. So irresistible urge to argue is also a manifestation of aggressive constellation. Offensive silent treatments, reckless behaviors, recklessness, reckless driving, speeding, seeking out risky situations. We see so many reels and shorts in the YouTube also, no, people doing all adventurous risky things and all. So these are all coming from the aggressive constellation. So passive aggressive people. So we have two types of behaviors in aggressive constellation. One is maniac and one is depressive. So maniacs will have that high energy levels, aggressions, verbal outburst, body piercing, tattooing, arguing, and all. So when it comes to that depressive state, depressive type means they will be manifesting as sarcastic, scornful behavior. They communicate in such a way that it hurts others. Insulting remarks are intended to hurt the other persons or coming from the aggressive constellation. So these we usually overlook, no? So we think that okay, this person is like this only. So this is a very daredevil category. So we usually think that it is all normal, but from GHK perspective, we will understand why this is happening and from where it all started. So why is this person behaving this way? Everything is very clearly understood from GHK understanding. So deliberate procrastination, a planned failure to accomplish requested tasks, backhanded compliments. All these things are coming out of aggressive constellation. So when you see a person deliberately procrastinating things and not doing the requested task and planned failures, all these things are coming from aggressive constellation. So you can understand why before 2 decades we were not having so much of aggressive constellation, why nowadays we are having so much of aggressive constellations, even in our own home and own territory also we see such behaviors, no? So it is all because we are not healing, or we are not allowing the body to heal ourselves or our conflicts. We are interfering repeatedly and we are making ourselves constelled. So in children, aggressive constellation is manifested as verbal or physical aggressions, disruptive behaviors, disobedience, resentful act out in class, bully other children, throw a tantrum. All these things we see so commonly in nowadays in children, no? So these are all because of the aggressive constellation. Thanks to the neonatal jaundice mismanagements from conventional medicine, they fortify the territorial anger conflicts instead of resolving them, and we see so much of aggression, sarcasm, disobedience, rebel behaviors, and all in children also nowadays. So domestic violence also comes from aggressive constellation. Not only domestic violence, the riots, sudden violent outbreaks in institutions or in cities and towns are also coming from aggressive constellation. So you must understand how important is it to resolve the conflict or to downgrade the conflict and allow the body to heal itself, and without interfering the healing symptoms, uh, how it is important to allow the healing symptom to complete itself. If you are not doing that, you will be instantly going in for aggressive constellation, which is a very destructive pattern. You could see all the things happening around this aggressive constellation. So with this, I end my presentation. Thank you. Thank you one and all for your patient listening. So I kindly request everybody to subscribe to our YouTube channel and also to watch the free videos in our website www.globalghk.com. So if you are willing to learn more about GHK in a proper way through experts from all over the globe, you may even subscribe to our paid webinars, and you will be allowed to watch all the uploaded webinar recordings for 1 full year uh, through the paid membership, and you will be having the privilege of attending the weekly Sunday webinars, which is open for all non-medicos, as well as the weekly Wednesday webinars, which is exclusively designed for homeopaths who want to include and apply GHK in their practice. So this is a very good platform for fine tuning yourself in GHK. So uh, with this, I request everybody to subscribe to our channel as well as to visit our Global GHK website. Thank you. Thank you, one and all.